appreciate that Ewa and Krzystof take part of this. I was Olina from the Medium Marketing and Product Manager, and we decided with our product Webiot to make a webinar to educate our veterinarians and tell a lot of new things, because how I see Ewa is really professional in oncology topic. As you know, you participate in nutrition and supplementation of oncology patient webinar. Nadia, varbūt. Jā, kas ir? Paseko līdzi, lai mikrofoni.
Labi, jā.
Yeah, okay. Please turn off your microphone, and if you want to say something, it's better to write and comment. Yeah, about Ewa. Ewa is, she graduated in 2012 veterinary medicine. 2015, she had earned her PhD in veterinary science in University in Cīrihes, and lot of trainings in veterinary oncology in Cīrihes, in animal oncology and imaging center in Switzerland. Worked in the Polish Academy of Science, and she worked as a veterinary oncologist in some of the most prestigious veterinary clinics in Europe and United States. As I understand, currently Ewa focus on translational medicine and a project related to fertility preservation on oncology patients. In 2019, she founded the Institute for the Prevention and Treatment of Animal Cancers. And she's definitely, if you will try to find information, there's publications and webinars where Ewa participate. And I think we can give a word to Ewa. And if you have any questions during the lecture, please feel free to write down them, and we will discuss them after the lecture. Ewa lecture, and then later will be another lecture. Okay.
Thank you very much for this introduction. So yeah, my name is Ewa Kautz Wasilewska, and today I will focus on the nutrition and supplementation in veterinary oncology. We'll be focusing on dogs and cats. I'm working as medical oncologist in my own practice. So that webinar actually and that presentation will be focusing on this medical oncology aspect. Okay, so let's start with the so-called oncologic tsunami. What is oncologic tsunami? So the scientists are sure that in following 20 years, we can expect so-called oncologic tsunami. So what is this? This is the super wave of the disease, which will cost us probably a lot of money. So $billions, billion of euro. And this is not only associated with the aging, but also with some factors like telomere shortening or telomerase activity, some chronic inflammation or DNA instability. However, this is also combined with the aspect that we have much more people than 100 years ago, and we are aging. And the same situation is seen also in animals and pets. So we can expect that cancer cases in animals will increase also in about 20% in the next 20 years. And the better question is, are we prepared for this impact? For now, as in the case of the human, cancer processes are also one of the main causes of death in animals. And as you can see, almost half of dogs over the age of 10 years will die from the cancer. and almost 1/4 of all of the dogs, regardless the age, will also die because of the cancer. In the cats, it will be around 1/3 of all of cats which will die because of the malignant form of cancer. So this is actually pretty shocking, and this will even increase in the following 20 years. The frequency of the occurrence of different tumor types in dogs and in cats are listed below in this table. And as you can see, the skin and subcutaneous tumors are the most common tumors, which are affecting both the dogs and the cats. But in most of the cases, they will be benign. They will be benign. The second most popular kind of tumor will be lymphoma or some other hematopoietic tumors like leukemia or multiple myeloma and so on. And in dog, it will be DLBCL lymphoma, and in cat, it will be mainly gastrointestinal form of the lymphoma, which are affecting mainly older cats. The third most common type of the tumor, which is affecting the pets, especially in Europe, it will be mammary gland tumor. In most of the cases, it will be malignant. For sure, in cats, it will be super malignant in most of the cases. 50% of the dogs will be suffering because of the benign, and 50% will have a malignant form. And this is in contrast to US, for example, where the early castration is occurring. In Europe, also in Poland, and I do believe also in your country, the early castration is not that popular as in the US. And we are castrating our pets, spaying, neutering after the first estrus cycle. And this is also combined with the occurrence of the mammary gland tumors. Other tumors which are affecting our pets will be located in the oral cavity or in the spleen, like for example hemangiosarcoma, which is not listed here, some bone tumors, which are affecting mainly the dogs, lungs, nasal cavity, and so on. But the thing is, what is actually the cause of the carcinogenesis, and what is the cause of the formation of the tumor? Actually, this is the typical question for oncologists, for veterinary oncologists. What is the cause of the carcinogenesis of the tumor? So what actually happened with my dog or with my cat? So the best answer for this question is that there's almost never one factor which is actually causing the tumor. It's mainly multifactorial. So this multifactorial etiology might be external, but also internal reasons. So external reasons which might induce the carcinogenesis is, for example, ionization, ionizing UV radiation, some chemical carcinogens, some viruses like, for example, feline leukemia virus, or bacteria like Helicobacter pylori, or some parasites like schistostoma. Lately, we have been also thinking that the trauma, like for example, fracture or some implants, some eye injuries might induce carcinogenesis, but it's not mainly, it's not supported by all of the scientists. So actually there is a different publication. So that's why I point the question mark in here. We have also internal reasons for carcinogenesis, like obviously genetic factors, race, familial frequency, and some kind of predisposition. like for example in boxers, which are suffering because of the mast cell tumor. In most of the cases, it will be low-grade mast cell tumor. However, lately we can also observe the more malignant form of the mast cell tumor, and this is also interesting. German Shepherd, which is suffering because of the hemangiosarcoma, as well as Swiss mountain dog, Bernese mountain dog, and flat-coated retriever will be suffering because of the histiocytic sarcoma or malignant histiocytosis. Hopefully, we are more and more specialized in the sequencing, for example. So in the following 10 years, we will be able to screen our pets and to choose the pets which will be actually affected and have the predisposition to create, for example, hemangiosarcoma or some other kind of tumors in the future. So especially in NGS, which is already available also for pets, I think this is what will change the veterinary oncology in the following 10 years. But coming back to the topic, today we'll be talking about the diets and about the supplements, and about the point of view of the owners. So, as you know, the cancer, the tumor is might be malignant and might be chronic and might be a devastating disease. So, and most of the cases, when the animal owner will go to the oncologist, we will be dealing with a malignant form of the tumor. So the owner is, in most of the cases, will feel guilty. Will feel guilty and would like to add some special diet right now to this pet, and would like to add some super supplements to this dog or cat. And we will have to talk with this client about most common mistakes and myths, and about basic interaction between drugs and supplements, and between supplements between each other, right? Because there's a lot of interactions, and actually nobody is speaking about this between each other. And the most the most important sentence will be that we cannot cure a patient with the diet alone or with supplements. However, we can influence their well-being, and this is important aspect in veterinary oncology. This is even more important than that we will cure the patient. So the cancer is, it's a chronic and devastating disease. So the malignant forms often requires a combination of pharmacotherapy, like chemotherapy or radiation therapy, immunotherapy, surgery, but also diet. And also supplements which should be added to this diet. So we can distinguish three general recommendations for oncological patient. First will be introduction of the diet high in fat, protein, and low in carbohydrates. Second will be administration of some omega-3 acids. And the third will be administration of some strong antioxidant complexes. And what about the goals? What about the goals in nutritional and supplementation area? So first of all, this is super important. Prevent or mitigate the cachexia in your pet. The second will be to support immune system of the pet, which is obviously also impaired. enhance the effectiveness of the cancer therapy. Yeah, that will be super cool. That when the supplements actually are working in the synergistic way together with the pharmacotherapy, for example, with the chemotherapy. And finally, the most important will be to improve overall quality of life. Okay, so I have very nice paper over here. That was actually pretty interesting what clients are picking when they have animal with the cancer. So just have a look on the unconventional diets and nutritional supplements which are commonly picked by the owners with the dogs with cancer compared to the healthy dogs. So so on this list, the top is the CBD oil with or without THC. The second was the turmeric, curcumin extracts, and the third was some mushroom supplements and others mixed mixed formulas. Okay. But first of all, what is cachexia? Actually, the cancer cachexia is a loss of the body mass, and it's including fat tissue and the muscle mass. And this is not only resulting because of the cancer, because of the that the tumor is eating the fat or muscle mass, but it's also as a result of from the action of excessively produce inflammatory mediators and the hormones, like for example cytokines or catecholamines or cortisol. So they are excessively bold in the body, and this is of course obviously the result of the all what is happening inside of the body of this pet. And the proteins, but also the fats, are necessary to build this hormone and to build these cytokines, for example, right? So we have three very big problems in the body of such a patient. First is the inability to use energy from fat and its production from amino acids. And this is actually causing a loss of muscle mass. Growing lack of appetite in cancer patient, limited regeneration. So sometimes we cannot actually go backwards to the previous weight. And also significant impairment of the immunity. This is also the huge problem. And this cat, which is actually here on this picture, this is a typical oncological patient, which is actually not supported by any protective diet or any proper supplementation, unfortunately. And we can distinguish actually three different phases of the oncological cachexia. The first is very intermediate, so it's subclinical, and we can see it only in biochemical changes which are occurring in the blood. The second will be clinical. So we are starting to notice that something is happening with the animal. So we can notice, for example, the loss of the muscle mass or loss of the fat tissue. And the third is already this what you can see on the picture with the cat. So if it's left untreated, it will end with in death. And that might be the reason of the death. And that's why we should start with some pharmacological, first of all, anti-emetic medications, but also with the appetite stimulants. And I will show in this table what I am using pretty often. First of all, I'm using maropitant. Not only on a date of the chemotherapy, but also 24 hours after. And I'm using the 1 milligram per kilogram single day. I'm sometimes using also metoclopramide and cyproheptadine when I have more problems. Excuse me. Okay. I'm using also mirtazapine, especially in cats, because it's in very nice form lately. So it's in the form of the cream, which we can apply on the ear. If we have a big troubles with the appetite and we have to stimulate it, then we are using diazepam or oxazepam, sorry. For sure, you know the body condition score scales, and you know when to check if you are actually close to the to reach the cachexia. So I actually point you to VSAVA body condition score, when we have a scale from 1 to 9 for dogs and for cats, when the 5 is ideal and the 9 is obese, and 1 to 3 will be under ideal. So you can only imagine that actually it's better to deal with the cat or dog which is over ideal than when you are having a pet which is under ideal. Most of them will lose the weight, and most of them will be actually suffering sooner or later with the cachexia. So actually, when I have this plumpy pets like dog or cat, I'm more happy to see it than to see under ideal dog or cat. And this is extreme. This is extreme example of the obese. So the Bobby domestic short hair cat, female, 10 years old, which was 14 kilograms, and actually it has some muscle tumors, and the starting weight was 40 kilograms. She was extremely obese. However, she lost 6 kilograms during the whole treatment. Actually, the treatment consists of the 5 years 5 years treatment. However, that was the result. So there's also some kind of publication which are supporting this thesis, especially in the cats. So the most important statement is that the cancer cachexia due to the cancer is more common in cats. And the cats, unfortunately, the cats can lose the muscle mass during the disease in over 90% of all of the animals. And in this study, this particular study, they lost, so 90% of all of the patients lost the muscle mass, and 60% of them lost the fat tissue from subcutaneous area. So this is extremely a lot of patients which suffer because of this. And the other finding is that the cats which present in the beginning with the body condition score over 5 had a survival time more than 5 times longer. This is something which is even for me kind of shocking. That so also in the similar study in the dogs, significant loss of the muscle mass was observed in around 35% of all of the animals, and but only 4% of them had a condition score under 3. So so that's the reason. However, you can see on this both diagrams that this median survival time was 5 times longer for the cats than when they have body condition score above 5 than below. And what about assistant feeding? So in some of the cases, you have a patient who, for example, which has some surgery or some other problems, and you will consider, okay, if it's the right moment to apply the assistant feeding and to use it. You can easily choose the type of the tube and to apply for how long you have to need it with this decision tree. However, remember that the assisted feeding is not appropriate for all of the animals, and sometimes animals which are suffering and they have the very terminate stage of the cancer should not be fed by this kind of tubes. They should be euthanized. So we need to provide very good quality of life. This is the #1 goal. So let's start with the diet. So we have some kind of dietary strategies in veterinary medicine. First will be high protein and high calorie diet. So this is essential to maintain the body mass and to meet increased energy demands, which are occurring obviously in oncological patients. However, this energy shouldn't come from the carbohydrate. So we have to take care that the diet will be low carbohydrate or even ketogenic diet. And the aim will be to reduce glucose availability to tumors. However, we have some kind of problems with the ketogenic diet because we know that it's working for human, it's working even for laboratory animals. However, there is no big studies available which will be saying, okay, it's safe for everybody, for every animal, for every cat and every dog. I think we can try to apply ketogenic diet, but we have to be super suspicious and we have to take care especially of the cats which are older than 7 years old, because we know that ketogenic diet might be potentially dangerous to the cats with some kidney problems. And therapeutic diets, so those are the specialized commercial diets which are designed for cancer patient, and they are often super cool. So they can improve the appetite, they can improve the stool quality, and finally they can also improve the overall well-being. So we will talk about the examples of this kind of diets. And the fourth aspect is to add something extra to this kind of diet, like for example supplements or some omega-3 fatty acid and so on, because as you will see in following few minutes, we will be discussing how the supplements actually might impact the chemotherapy and so on. So coming back to the diets and to the carbohydrates, just a short reminder for you. Tumor has 3 sources of the glucose, 3 sources. First will be glycolysis, second will be gluconeogenesis, and the third will be the Cori cycle. Cori cycle, which is actually here on this picture. Actually what is important about this, the Cori cycle, is that it's driven by release lactate. So we have to be careful on the glucose, but we have to be also careful on the lactate. And unfortunately, tumor growth causes increased demand for glucose in the body of a cancer patient. So the diet should actually contain the low carbohydrates ratio and the glucose intake should be minimized whenever it's possible. Sometimes it's not possible. I'm aware of this because we are sometimes, especially cats, the patients which are not interested in other diets. So they are since many years eating just commercial diet, even fast food diet for pets, which is not very good, and it's not having the nice script, but an ingredient list. However, even more important than this will be that your pet and your owner pet will be eating. It will not be starving. So whenever the dog or cat is eating, this is the most important. And then you can manipulate, and you can start to lower the glucose amount and to increase the protein or fat ratio. And sometimes it's not possible to perform it, but it's nice to try it. So the calories can be, of course, supplied to the body by increasing the amount of the fat and of the protein. And in many cases, especially in dogs, it's possible because the fat is actually tasty for this animal. However, especially in the cats, we have to control the kidneys, and we have to control the creatinine and the urea. So if you have an owner who is actually performing the home nutrition and it's preparing the food, but by him or herself, we should talk to this client and convince him to avoid pasta, potatoes, cereals, and so on. And what is important is that we should also not give the glucose solution in the veterinary hospitals. So we should avoid this kind of fluids and the added lactates in fluid therapy. Even ringer lactates shouldn't be applied to this patient. So even if you are applying the chemotherapy and you are using the fluids to dilute this chemotherapy and to perform the 30 minutes fluidotherapy, you should use the natrium rather than the ringer lactate or glucose. Minimal carbohydrate content ketogenic diet is the solution. That will be cool. However, we still don't have enough data about the ketogenic diet in the pets. However, we know that tumor cells are addicted to the glucose, so they cannot grow without the glucose. And the concept of starving cancer by limiting the carbohydrate content of the diet is it's actually discussed lately. Also in the papers where we can see even in the laboratory animals that a ketogenic diet can even decrease the tumor size and support the chemotherapy, support the overall well-being of this kind of animal. So is this a future solution for cancer patient? Of course, it will be a future solution. However, we are waiting for more data. First, it was tested in mice in the 80s, last century, by Teasdale. That was one of the first papers which was released about the keto diet in the animal, and we have seen the reduction in the tumor size and improved condition in this animals with colon adenocarcinoma, which were fed with ketogenic diet. And after this time, we have even more scientific proofs that and some later studies which confirm this inhibition of the tumor growth and some prolonged survival in animal models in stomach and colon and in prostate cancer. However, yes, no clinical trials have been conducted on dogs and cats to date. We are still waiting for some nice studies on the nice group of the patients. The second compound we will discuss will be proteins. So the proteins are the #1 ingredient which should be actually included in the oncology patient diet, because the proteins body and the growing tumor have a huge need for protein, huge need. So what are we expecting is negative nitrogen balance, and this will be combined with the increased catabolism of the skeletal muscle proteins and with the decreased muscle protein synthesis, with increased protein synthesis in the liver, like, for example, a formation of the acute phase protein, and with immunosuppression and some problems with immune system because of the lack of the substrates for antibody production. And finally, what is also typical for oncology patients is the poor wound healing because of the lack of the proteins. So what we can do about it is a supplementation of the proteins. So the cancer cells use these proteins to synthesize their own building and functional proteins. But we should use the proteins as a #1 product in the diet, and should constitute at least 30% of the dry mass. That's very important. From the other hand, we have also a study about the methionine, which was conducted in 2019, which was assess the effect of the low methionine. Methionine is also an amino acid, but here the low methionine ratio was tested on the growth of colon cancer in mice, and afterwards it was also tested in the soft tissue sarcoma in mice. And what was interesting is that the low methionine ratio in the diet actually decreased the tumor size, and it was also actually the nice compound for overall well-being of these animals. And reducing the methionine content in the diet might therefore be some kind of interesting strategy to support this anti-cancer therapy. However, we need some more studies about it. Few words about the fats. So the fats are necessary for oncological patients to maintain this calorie, to enough calorie ratio for dogs and cats which are suffering because of the cancer. However, we can see some kind of side effects of the high caloric, high in fats diet, especially changes in the blood lipid profile and in such a patients, like increase in free fatty acids, in LDL and triglycerides, and finally the ketone bodies. So this is the second source of the energy and calories after protein. However, this increased level of fat in the meal has also positive effect in the taste of the meal, especially in the dogs. Be careful with the patients which are suffering because of the pancreatitis. The fats will be contraindicated. So if you have a patient suffering because of the pancreatitis, you have to be super careful. And generally, at our clinic, we are mainly not recommending this kind of diet for these patients. Other facts about the fats are pointed here. They are mainly focusing on the omega-3 acids, which are super cool, and I can recommend them to almost all of the patients which are dealing actually with the tumor, with the cancer, because of their anti-cancer effects, which are very well documented in the literature. So just remember that both EPA and DHA, they are presented in the fish oil. So those should be derived from the fishes, not from the vegetable oils. And they are having this nice anti-inflammatory effect because of the reduction of the intensity of inflammatory processes, which are actually commonly seen in the animals with the cancer. And they are also trying to block, or they are blocking pro-inflammatory cytokines and enzymes which are involved in maintaining the inflammatory response. And finally, EPA acid can also inhibit the proliferation of the cancer cells and induce their apoptosis. So just the benefits and almost no side effects. Just be careful on the animals which are suffering because of the pancreatitis. Besides this, they are pretty safe, and the effects are very well documented. However, the last statement, which is pointed on the yellow field, is super important, because fish oil should not be replaced by the linseed oil or some other vegetable oils. Why? Due to the insufficient conversion from the alpha-linolenic acid to the DHA and EPA, and we need this kind of omega-3 fatty acids. So DHA and EPA will be the most important for cancer patients. And we have also study from 2000. Which was actually evaluating the effects of the fish oil, arginine, and doxorubicin chemotherapy on remission and survival time for dogs with lymphoma. And in both tested groups, like of the animals who received doxorubicin, arginine, and fish oil together, the median, so the DFI, so the disease-free interval, was significantly longer than the control group. And the same aspect was seen also for the overall survival time. So the dogs in this treated experimental group were living longer, and almost no side effects were visible. So this is actually something which we can already add to most of our oncological patients, especially in dogs. Those are the commercial diets examples which are picked from the internet. However, you can choose whatever you want. Just be careful. Be careful on the ratio. So be careful that the diet will have at least 30% of the proteins in the dry mass, that just have a look if there is some addition of the omega-3 fatty acid, and if there is a nice relation between omega-3 acid to omega-6. And if it's not provided, apply it additionally. So don't forget about the supplementation of the omega-3 acids. But most of them are having the at least 30% of the dry mass of the proteins. They are containing the fat and the low carb ratio. Now we will slowly go to the supplementation, which is extremely important, especially for Polish clients. We love to buy supplements for ourselves, but also to our pets. So many clients are asking what we can do more for our pets that it will feel better, and it will and we will maybe slow down a little bit of this oncological disease, or we can support them even in the other way, like for example support of the cachexia. And the first supplement, which is super cool, is the HMB. So whoever is working out on the fitness for sure know this supplement, because this is actually the supplement which can be beneficial and can have this beneficial effect on the muscle tissue, and it's slowing down the process of the cancer cachexia. So the thing that we are very scared about. And these are the inhibition of the protein degradation. This is how the HMB is working, but also the stimulation of this synthesis, the protection of the sarcolemma, and from another hand, also stimulation of some insulin growth hormones, stimulation of the satellite cell proliferation, and the inhibition of the muscle cells apoptosis. And HMB, it's already tested on the dogs and cats. So the knowledge it's also gathered in the PubMed and in other scientific websites. They support that it's preventing the cancer cachexia, and the recommended amount of the HMB calcium salt for dogs and for cats should be approximately 60 milligrams per kilogram body weight per day. The problem with the supplement might be the taste, because most of the animals have to eat a piece of this powder or capsules which are provided. So not all of the animals will be able to eat such amount. So it's mostly a nice solution for dogs. For cats, it's a little bit, it might be a little bit tricky because of the amount that the cat has to swallow every day. Capsaicin, this is also interesting supplement which we can add to the oncological patient diet. We have some nice studies performed by the Polish group of scientists who are actually testing the effectiveness of capsaicin containing dried habanero pepper extract in the treatment of the primary hepatic cancer in geriatric dogs. And actually they tested only in the animals which were suffering because of the hepatic cancer. However, the preliminary clinical observation by the authors was indicating that the capsaicin containing habanero pepper extract have very nice effects on the liver tumors in dogs. And what is not obvious, but it's very important, it was well tolerated by the animals. It was well tolerated by the animals, and the result generally provides such a good sign for the future studies and for some other alternative medications which might be used in the veterinary oncology, especially in dog. Capsaicin was also tested for after this study with the hepatic tumor. It was also tested in the other type of tumors, like for example mammary gland tumors and some skin tumors and so on. And in most of the cases, we have seen that the disease, so the cancer, the tumor, decreased in size. It was maybe not spectacular minimalization of the tumor, but it was something between 10 to 50% of the minimalization of the tumor. Of course, in some animals, nothing spectacular has happened, but that will be just a good knowledge to speak about the supplementation with the client, with the owner, because many owners are reading a lot of stuff in internet, and they would like to know our opinion about some kind of supplement. So capsaicin, why not? However, always check the interaction between the drugs. Actually, I didn't point it here because it's not possible to point many interactions which are actually going on between the drugs. However, we have some nice website, like for example drugs.com, which are actually testing the interaction between supplementation and between the medication. So we can always go to the internet and check it before the application. Transresveratrol. This is the substance which is actually originating from the plant. It might be found, for example, in the grapes, but also in the berries. What is the best in transresveratrol is that it's neutralizing the free radicals. It's also inhibiting the formation of the new blood vessels in the tumor tissue. And finally, it's able to modulate the level of transcription factors and the expression of genes, which are encoding some proteins, which are, for example, presented in the signaling pathways, regulating processes related to cancer. And finally, it might also induce the apoptosis of the tumor cells. So super cool supplement, which might be used in the dogs or cats. And quercetin, which is belonging to the group of bioactive plant compounds with antioxidant activity, called flavonoids. They are actually on the focus on the main laboratories. So the flavonoids generally are the future of the oncology, not only veterinary oncology, but also human oncology, because of the super potent anti-cancer potent to the and fighting against the tumor cells. This quercetin is yellowish because of the natural plant dye, and generally it might be found in many fruits, like for example apples, berries, grapes, but also in vegetables, and it might be seen in green leaves and in broccoli. In humans, we already know that quercetin has confirmed anti-inflammatory and anti-cancer and even anti-arteriosclerotic properties. What's more, it's also supporting the weight loss. So many advantages for the human. Fortunately, we have a nice supplement which is actually combining these two previous substances, so transresveratrol, quercetin, and it's also containing the selenium and vitamin E, which all together are having very strong anti-cancer effect. This particular supplement has a great benefit because it was tested by the Oncological Center for Humans, and it was clinically tested. We know it's safe, and we know it's working. It's working for laboratory animals, especially. And we know that it's safe. It will not cause any side effects in the pets. So whenever you are having this kind of problem, what kind of supplement may I provide to the oncological patients? Always first take this one, which is clinically tested, which is safe for the animal, and it's dedicated to the dogs and cats. And afterwards, if it's not available, try to take this, which is dedicated to the human. Of course, quercetin has also some kind of limitation. The supplement is generally safe for animals. However, the problem might be with the low bioavailability from the GI tract. And there's one study, another study which was conducted in 2019 on the canine osteosarcoma cell lines. And what we found in this study was that quercetin reduces proliferative properties and increases programmed cell deaths, and it might even change the cell cycle, and it might induce the apoptosis, so it participates in mitochondrial depolarization, and it might also increase the level of reactive oxygen species and some cytoplasmic calcium concentration. So a lot of good stuff what the quercetin might do. However, we have also some kind of warnings. So if you are using the supplement with quercetin, you should be very careful with some interaction with the chemo drugs, especially with the mitoxantrone. So the mitoxantrone is the drug which is interacting with the quercetin. When they are used together, it might increase the side effects of the mitoxantrone. So mitoxantrone we are using especially for the treatment of the TCC in dogs and sometimes in cats. This is fortunately the drug that we are not using very often. So sometimes we are having this kind of problems. However, whenever you have a patient which is receiving the mitoxantrone, you should avoid supplements with the quercetin. You can start to add it after the chemo cycle. So the mitoxantrone is generally given 4 to 5 times every 3 weeks. So after this 15 weeks, you can easily add the quercetin back to the animal. Other interactions with the medication you can easily find on the website, like for example drugs.com. And quercetin is interacting also with some antibiotics, with corticosteroids, with the cyclosporine, and with the digoxin, with fluoroquinolones, and also with medications changed by the liver. CBD oils. CBD oils, super popular in the last 5-10 years. They are interacting with the endocannabinoid system. This system you can see, and the main receptors you have pointed here on this picture with the dog. So what is endocannabinoid system? This is a complex, widely distributed regulatory system that provides essential mechanisms for maintaining the homeostasis in the body. And this essential neuromodulatory network has been identified in many species. And obviously, if you provide some CBD oils to the patient, you are often surprised, why this is sometimes working pretty well and sometimes it's not working at all. Why? The reason is actually how many receptors of the endocannabinoid system the animal or human has in the body. So one animal will need one drop to have a nice effect, nice calming effect, and another will need one bottle to have the same treatment effect. So, however, we cannot almost see the side effects of the CBD oil. So you cannot even overdose this CBD oil. There's one exception, of course. CBD oil, which is containing the THC, might be dangerous when it's overdosed. However, when we have the extracts or when we have the broad spectrum CBD oil, then actually we are almost safe. So we cannot do much. We cannot do almost any side effects to this patient. Of course, there's another exception. The patients with the pancreatitis, those kind of patients are also shouldn't receive a lot of oils in their diet. So coming back to the CBD oil, so we have seen the promise in treating cancer in dogs and in cats due to the potential to reduce the tumor growth, release the pain and inflammation, improve the appetite, and reduce nausea, and improve the overall well-being. I can see it in the clinic, on the everyday clinic, especially in the cats. So the cats which receive the CBD oil, so 2/3 of them will respond on this treatment, and they will feel much better, and their appetite might increase, and they will feel also, yeah, that they are out of the pain, let's say. So that's a nice effect. In dogs, the thing is that half of the dogs will respond on the CBD oils in our clinical observation, our own observation. So just a short reminder, we have types of CBD oil. There's not just one CBD oil we can use. We have many types, and it of course depends on the regulation of the countries, what can we use and what we cannot use. So the CBD oils, of course, they are derived from the cannabis. However, most of them are having very, very small amount or even 0% of the THC. The full spectrum CBD oil will have some small amount of THC. Of course, not a huge amount because it will be toxic to the dogs or cats. However, the full spectrum is generally the most potent CBD oil we know. The lasting effects are between 6 to 8 hours, in contrast to the isolate, for example, when we can expect just up to 4 hours effect. However, here we have no THC, as well as in broad spectrum. So in Poland, we have especially broad spectrum CBD oils, which are lasting from 4 to 6 hours, which are containing no THC or 0.2% of the THC because of the Polish law. However, if you have some better regulation, it's always nice to try the full spectrum CBD oils too. So the CBD oils are widely tested. We have a lot of publications which are supporting this thesis, and they are tested on the many cell cultures of the various canine cancer, like osteosarcoma, mammary tumor gland, carcinoma, and lymphoma, and so on. So especially this paper, which is cited here, that was the nice publication, which was actually testing the CBD alone and in combination with the chemotherapy drugs, commonly used chemotherapy drugs like doxorubicin and vincristine. And what was the finding? CBD oil caused a significant decrease in cancer cells reproduction in all cell lines which were tested. And full spectrum oil was able to reduce the cancer cells reproduction at lower concentration than the pure CBD oil. That's the fact. And this is probably due to the so-called entourage effect, in which a mixture of the multiple chemicals appears to work together and to produce finally the greater effect. So CBD with the combination of with vincristine also reduced the cancer cell reproduction in the very synergistic way. So with the greater effect than any other chemical alone. That was actually nice finding. What is also important, some kind of pets will not swallow the oil because of the taste, because of the texture, and so on. Generally, I am recommending that the owner will apply it on the mucosa, on the in the mouth, twice daily, so in the mornings and in the evenings. But some pets are like resistant; they are not able to swallow it, and I might not be sure, but in our clinic, mainly we have problems with the dogs, not with the cats, and with the oil form. So the dogs might receive the bites. So we have some snacks with the CBD, and we can provide them to the dogs which are not accepting the taste of the oil. Coming back to the omega-3 fatty acids, I'm very excited about the EPA and DHA. They are extremely nice supplements, and they have a lot of benefits in application of this supplement. So anti-inflammatory properties. It might also improve the survival times in some certain tumors, and this is supported by the literature, and support cognitive function, especially in aging cats. And even more benefits we can talk about. So side effects of the omega-3 fatty acids will be that they are supporting the transport and absorption of the vitamin A, D, E, and K. They're also building the blocks of the body's cells. They might regulate all of the inflammatory processes which are occurring in the body. Obviously, the side effects will be seen also on the fur. So the fur, the skin will be smoother, the coat will be nicely looking. So the positive effect on this, and supporting the development and functioning of the nervous system, participating in controlling the production and secretion of the hormones. 3 examples of the oils which might be used. I'm not sure if you have some kind of this kind of supplements in your market, but it really doesn't matter. So omega-3 acids, fatty acids, might be applied in many forms, in capsules, in liquid. It doesn't really matter. You have to be just sure that it's derived from the fish, from the fat fish, like, for example, from cod liver fish or other fishes, not from vegetable. And some other studies, like this paper, which combines information from 23 studies. 20 were conducted in dogs and 3 were conducted in cats. And they were examining the effect of omega-3 supplementation on clinical signs in various diseases. So therapeutic benefits were found in, for example, allergic dermatitis and some dog coats disorders with some problems with the eyes, like keratoconjunctivitis, or even valvular disease, or like, for example, with some joint problems like degenerative joint disease in dogs and cats. What's more, dogs which were diagnosed with chronic heart failure, lymphoma, and cats with allergic dermatitis also appear to benefit from omega-3 supplementation. However, even more studies might be necessary to support the thesis that they are working ideally for this kind of tumor and this kind of tumor and so on. So we know that the recommended dosage of the DHA and the EPA will be around 500 milligram per every 5 to 10 kilograms of the body weight. And don't be scared, it's not easy to overdose the omega-3 fatty acids, so it's nice to provide it. Another supplement which is here, it's Boswellia serrata. Boswellia serrata is the substance which is also derived from the plant, and it has some strong anti-inflammatory properties in vivo and in vitro. It might exert the immunomodulatory effects, so be very careful with the cancer, with the tumors like lymphoma or leukemia or other tumors which are originally coming from hematopoietic tissue, like from bone marrow, for example, because it might affect and might be contraindicated in this kind of tumors. However, besides these examples, Boswellia serrata is super cool, and it's strongly anti-inflammatory. It's modulating the immune system to fight against the tumor cells. It also regulates the vascular responses to inflammation. And in the case of for example, intestinal inflammation, it can also modulate the adhesive interactions between the leukocytes and the endothelial cells. However, we can see some adverse effects. This might be nausea, epigastric pain, and the diarrhea. And what is interesting in this Boswellia serrata is also the bioavailability. So the thing is that when you are applying the supplement and when it's taken with the high-fat meal, the plasma concentration will be several times higher than when this herbal preparation will be taken on the empty stomach. So be careful how you are applying it, and be sure that you are applying it in always in the same way, to not overdose it or to not impact on this adverse effect, and not to induce this adverse effects in your patient. It's very well tested, so a lot of publication which are available in PubMed and other scientific websites, which is supporting the thesis that it's nicely working for the cancers in laboratory animals. However, again, no studies have been conducted on the effects in animals with oncological disease, I mean in pets. So still we are waiting for this kind of information. I'm not using it in everyday clinic. However, I have some owners who are asking if they might add it. And that's why it's always good to know something more about the supplement to explain what to do with this kind of animal. From another hand, I'm recommending the curcumin because of its well-known effects, like anti-proliferative and anti-angiogenic properties. It might sometimes enhance the effectiveness of the chemotherapy, for example, doxorubicin chemotherapy. However, there's one caution: potential blood thinning effects. So we have to aware our owners to talk about the supplements they are providing. So even curcumin has a lot of interaction and has some side effects and should be discussed before it will be used. What does curcumin? This is bioactive component of the turmeric, and it has several mechanisms of action, which is well known. First will be inhibition of the cancer cells proliferation in several cell lines, which was tested. It's also lowering COX-2, LOX, and NOS expression and the local tissue. So it's working as an anti-inflammatory drug, a supplement. Sorry. And the limits and the another effect is that it limits the production of necrosis factors like tumor necrosis factor, but also chemokines and some cell surface adhesion molecules and some growth factor receptors. But as I said, it has a lot of interactions and can inhibit chemotherapy induce apoptosis in breast cancer, for example, especially when it's combined with the doxorubicin. However, when we are using the synthetic analog of the curcumin, it's paradoxically helping reducing the doxorubicin-induced cardiotoxicity through this dual anti-tumor and antioxidant functions in vitro. And this is actually very nice finding. In addition, the curcumin together with the catechin, which you can find, for example, in the green tea, might work in the very synergistic way against the cancer and through cytotoxicity, nuclear fragmentation, anti-proliferative and pro-apoptotic effects. A lot of publications, a lot of interactions, and a lot of publications which were testing the curcumin and the human medicine and the laboratory animals, but also in veterinary oncology. So well-known effect, and those were studied not only on the cell lines but also on the clinical trials. And this is very important, and I'm always double checking if the supplement was tested only on the cell lines or also on the patients. Obviously, if we will use some kind of magical supplement on the cell line alone and it will work, it doesn't mean that it will also work for animal which is alive and it has to be absorbed from the intestine. So double check before use and perform the very good anamnesis before the application of the supplement. So whenever the dog or cat is appearing in the on the oncological consultation, I'm always asking for every single drug which is used and every single supplement because of this cross interactions. Yunnan Bio, I don't know if you know the Yunnan Bio. We are using it in Polish veterinary oncology since few years regularly. Yunnan Bio is a Chinese herbal blend consisting not of ginseng, and it's famous because it's controlling the bleeding. it's controlling the bleeding, and it was tested in the Chinese medicine, of course, but it was also tested in the hemangiosarcoma in dogs, especially those which already broke down, and we have this hemorrhage, or we have a bleeding seen in the abdomen cavity. So it's nice to add it. All of the patients with hemangiosarcoma are receiving the Yunnan Bio. Right now in Poland, we have some troubles with the distribution of this supplement. However, sometimes we are able to buy it on the internet, in the Amazon and other websites. The bad side of this Yunnan Bio supplement is that most of the dogs has to eat quite huge amount of these capsules. And we have to be careful about the overdoses, because some studies, again, on the cell lines, but yeah, we have to be patient. If for the clinical studies, it's this particular supplement and the study on hemangiosarcoma cell lines are inducing the death via capsas-mediated apoptosis. So this might indicate that high dose of the Yunnan Bio might also be toxic to the bone marrow stem cells. So this is the side effect, which is not always needed for oncological patients. However, it's very well tested in the Chinese medicine and the human studies. Yunnan Bio sometimes it's even administered a few days before the surgery, and we know from papers that when it's applying even 3 days before surgery, it's significantly reducing intraoperative bleeding, and that's a nice side effect of the Yunnan Bio. No side effects were noticed in this study, and generally, whenever dogs are, because we are applying it mainly for dogs with hemangiosarcoma, those dogs are tolerating it very well. So there is a good tolerance of this supplement, and we know even the dosage. So the dogs under 10 kilograms is 1 capsule 1 time per day. Of course, it depends on the Yunnan Bio, which cell, but mainly you will find it in this particular box. So dogs between 10 to 30 kilograms, 1 capsule 2 times per day, and dogs over 30 kilograms, 2 capsules 2 times per day. So if you have 16 capsules inside, the box is empty in 60 days for the small dog and in 4 days for large dog. So be careful about it. However, we are regularly using it, and we have nice effects. So maybe we cannot stop the hemangiosarcoma in our patients, but we are able to stabilize the bleeding, and this is also nice side effect. We are going to mushrooms. First mushroom is the Corollius versicolor, so-called turkey tail, because of this typical shape, which is actually commonly used in our patients, but generally in most of the cases it's applied by the owner. So the owner is coming and is asking, oh, may I use some kind of mushroom? So if you have such a client, I would rather give him or her Corollius versicolor as a first, because it's widely tested also in dogs. It has some nice results as a alone, but also in the combination with the doxorubicin in many types of the tumors. So and there's almost no side effects noted. However, once again, be very careful with the animals suffering from the hematopoietic tumors like lymphoma or leukemia. because of its potential interaction. And Corollus versicolor might have some influence on the immune system. It can have this immunomodulatory function, so be careful in this particular cases. Maitake, in one study conducted on human cancer cells, it was found that the so-called diffraction activated the natural killer cells. So this is one of the best known medicinal mushrooms. Again, almost all of the mushroom will be rich in beta-glucans, but this is famous for this diffraction, which is specific for maitake. And this fraction is extracted and tested for anti-cancer effect. And in many studies, we can observe that the tumor growth is slowing down and it's reduced, and the development of the metastases are also reduced. Chaga, this is also a mushroom with the huge potential of the oxygen radical absorbance capacity. So it ranks first on this ORAC scale. The chaga mushroom contains the triterpenoid compound called lanostan, which increase the T cell production. So again, it's influencing the immune system of the patient. And according to one animal study, chaga is effective in reducing the number of the cancer cells and the tumor growth. Of course, we need some more studies in this field. However, the scientists found around 60% reduction in tumor size in mice, in laboratory animals, after giving them chaga mushroom extract for 3 weeks. Chaga mushroom, I have just few patients which receive the chaga. However, mainly they are receiving the turkey tail or reishi. However, chaga sometimes the owner already have read the papers like this, for example, and they are convinced that we have to start with the chaga treatment, and we are starting with this. Reishi, I mentioned reishi mushrooms. They're one of the most popular Asian mushrooms, called Ganoderma lucidium. This mushroom is again rich in the beta-glucans and has this immunomodulatory effect on the immune system. Here is another study which is cited here about the effects on the extract on chemotherapy-induced nausea and vomiting in a rat model. And actually, in this rat model, Ganoderma lucidium decrease the side effects to minimal level caused by the chemotherapy-induced nausea, and that was very brilliant. We can see the similar effects on our patients. Reishi is popular in our country. So why it's so nice? The thing is that it's having this anti-inflammatory effects, but it's also able to inhibit the release of the histamine, and it's having this calming effect. In many preclinical studies, these compounds contained in reishi have shown also the increased immunity in the cancer patients. So once again, be very careful with the lymphoma, with some other hematopoietic tumors. And in people, it might improve the cancer-related symptoms. I can also see it in my patients, which are receiving the reishi, so they are feeling better with these extracts. They are feeling more relaxed, more calm, and generally, whenever they are receiving the chemotherapy, we can see less side effects caused by the chemo, so they are not as sick as they might be. And last not least, the caution between the interactions. Interactions might be between the drugs, between each other, between the supplements with each other, and between drugs and supplements. So the herbs and other substances for immunity, like these mushrooms, this reishi mushroom or the turkey tail, but also echinacea, which is presented on this picture, or other herbs which are affecting the immune system, they might promote the proliferation of the lymphocytes and might even worsen the situation of the patient with lymphoma, where pathological multiplication of the white blood cells is occurring. So this is it, what I was mentioning before. Other is inducing and inhibiting the drug metabolizing enzymes, and some other might even act as a antioxidant. So they might also influence the chemotherapy. So always check it, check the interactions. This is the clue of this supplements blog. And for now, I think this is it for me. If you have any questions, write down or ask for it. Thank you very much.
Yes, thank you, Eva. Have any questions after this long but really interesting lecture? I think your clients are really about this, how you said, supplements they are using, and for the pets as well. And then they even come and ask, can we use this or that mushroom? But most of all, actually, one question, while maybe another ones are writing or thinking what to ask. Most of all, you use like a human ones and then check the dosage.
Mm-hmm.
Yeah.
So it depends, actually. So in the beginning, when I didn't know reishi, for example, I have been using the publications to apply that to the animals. However, sometimes in some crazy supplements, which are not even mentioned in this presentation, sometimes you have to be creative and you have to divide it for the kilogram mass of the animals. But most of them are tested, as there are publications with the milligrams you have to use per kilogram of the body weight. So it's easy to apply it right now. However, I need to mention that the clients are more and more into the holistic taking care of the animal. So it's not only about the chemo, drugs, fighting, but also this well-being to have this nicely effect, which might be conducted from the supplements or from the diet. So this is the clue of the 2025 treatment of the oncological patient.
Yeah, I can't see any question. Just thank you so much, Dr. Ewa. It was very interesting and worthwhile. Yeah.
Thank you very much.
Okay, if some question will come in, we can contact with you and maybe answer it later. And next one will be Krzystof. He will talk some topics about the researches and the results and tell more about Webiote product. and he's with a degree with biotechnology and earned a PhD in veterinary parasitology from the National Veterinary Research Institute, and driven by a strong interest in translating scientific research into practical, market-ready solution, he joined the online Nutrifarm group in 2016. Since then, he has been instrumental in building the Webiot brand from the ground up to overseeing its research and development, medical marketing, and strategic business direction. How I understand, now Krzystof, he's really into the science, and that's what he's doing in Nutrifarm and with the Webiot is integrate the scientific innovation with commercial strategy. And how we met, we started, the Medium team started work this year with the Webiot brand. And what already Eva mentioned, neoplastic sun, and I think quite a lot of veterinarians already hear about Webiot brand, and especially the neoplastic sun, what's the product for oncology, and that's interesting product, and we haven't got a lot of these in Latvia market. That's the same situation in Poland, and we will give the words for the Krzystof to tell a bit more about the research, what includes the supplement, what's in neoplastic sun, and as well about the product.
Thank you, Aya, for this lovely introduction. Hello, everybody. It is great that we have so many people here. I will share my screen. Just give me a second, because I would like to also share my slideshow. Okay. Just a minute. Is it visible? Maybe.
Yes.
Okay, thank you very much. So, yeah, my name is Christopher. Nice to meet you. Today, I am honored to give you a presentation entitled Behind the Neoplastic Sun, Resveratrol and Quercetin, Review of the Study. I decided to expand a little bit the title, because the first title was only about this study of the complex composition of transresveratrol, quercetin, vitamin E, and selenium, because it's a first occasion to tell you about the neoplastic sun, maybe on more scientific side, and give you also some practical examples or the practical usage of the product. So that was the reason that we will tell maybe mostly about this, and this study thing is something additional, but it's very connected with the whole history of this product. Okay, so just a few words about the company. I will try to make it very fast. We are the Webiot is the part of the Olymp Laboratories, Olymp Nutrifarm Capital Group. The group started functioning in the 1990s, but our brand is 8 years in a Polish market, 9 years now, and also the neoplastic sun product is 9 years in a market. What is very important for us as a company, that there is lots of research behind each product. We have very strict quality check, quality assessment team. Everything is manufactured in Poland, and what is very important, that we cooperate with external stakeholders such as scientific institutes. And at the end of the day, most important is customer experience, and luckily we have very good customer experience. Here is a screenshot from the Allegro. It's a Polish marketplace, like something like Amazon. So as you see, the review of our clients is very good, and also for the neoplasmoxan, the review is very high. Speaking of the devil, I would like to introduce the products from some theory. So the indications for the products. So the product is for individuals with diagnosed cancer, elderly individuals and breeds predisposed to cancer. So a little bit prophylaxis here. Individuals requiring palliative care to improve their comfort of life. So if we cannot help treat an animal in a proper way, we can improve the comfort of life. That's very important. Eva also told you about it. What is in this product? We have transresveratrol, we have quercetin, we have vitamin E and selenium. And today I will tell you more about these two main actors, transresveratrol and quercetin. So first question is, how does it work? What is behind those products? So the action is very complicated, and even if we have such a amount of data, the amount of the publication about the resveratrol and quercetin is very high in the context of cancer only, but in the context of the health is crazy high, I would say. We still do not have known the exact relationships between some chemical pathways or I don't know, the physiology of the substances. So just to mention a few, the resveratrol and quercetin will work on the DNA stabilization, so also the DNA reparation, transcription modulation, epigenetics, example microRNA. I will tell you later about the microRNA, signaling pathways, tissue architecture, immunomodulation, and antioxidant. And this last action brings us automatically to DNA stabilization, because these two are very connected. On the right side of the slide, you have just the example of the data that authors shown that resveratrol will inhibit certain signaling pathways in a cancer tissue, and it ends up with inhibition of the proliferation, metastasis, invasion, migration, and angiogenesis. So the features of the cancer tissue. Also, the common question is, how does it work in the context of, can I treat any patient in any cancer stage of the cancer with that? And the answer is yes, because it acts, here is the resveratrol example only, but it's also relevant to the both substances. Resveratrol here will act on a initiation. So before initiation, it will reduce the reactive oxygen species, the action of it. So antioxidants simply. It will reduce the carcinogenesis in general to inhibit some genes that are immune, that are cancer prone. Inactivation of a tumor suppressor gene as well. So it will stop, not totally, but in some point it will stop the initiation of the first cancer cell appear in an organism. But later on, if we have first cancer cells, the resveratrol will also works. Here is the only example that it works on the apoptosis and the proliferation by the reduction of AKT pathway. Later, we have cancer in situ. The cancer is in the organism, so the resveratrol can stop it by induction of apoptosis, reduction of tumor angiogenesis, and reduction of the oxidative stress. So if there is a patient, it can be treated with these substances in every stage. So another question is, where does this apply? Or maybe the simpler question, what kind of cancer I can treat it, or I can support, what kind of patient I can support with these substances? So the question is, every type of cancer can be supported by those substances. Here are also the examples. The quercetin and its action mainly by the microRNA inhibition. So the microRNAs are the specific RNAs that will cleave the messenger RNA and stop the translation processes. So it stops the making production of the certain proteins that might be beneficial for a cancer development and distribution. So here is just the example and what it ends up. And also here on the right side, there is an example for the resveratrol action on the 3 selected type of cancers. But as I mentioned, it's just the example. If you make a search on the literature, you will find a lot more of the examples how both substances support patient in a cancer. So, and the word support here is very important, because I don't want to make an impression that we actually cure a cancer. It's very important to remember that. So regarding my last sentence, the resveratrol and quercetin, so our product, should be used together with standard therapy when it's possible. So first of all, you should make a surgery, make a chemotherapy if possible, and after that you can add the supplement or add the diet. As Eva mentioned, it's very important to have a holistic approach to the patient. So yeah, then one way to use the neoplasmoxan is to use it before the surgery, because it's reduce tumor growth size. So if the tumor is smaller, it's easier to dissect it, or it's possible even. Sometimes we have some patient that at the beginning of the treatment, it wasn't possible to dissect the cancer. And after giving of the neoplasmoxan for a certain time, the veterinarian decided to make a surgery. And also before surgery we have information also from fields, not only from the scientific literature, that the neoplasmoxan reduced the tumor angiogenesis, so it also reduced the intraoperational bleeding. So that's very important. And here is the mechanism and some figures taken from the here is an in vitro research that the transresveratrol reduce the vascular endothelial growth factor in a research, and this factor is strictly connected with development of the blood vessels of cancer. Also, it might be given after surgery, not only before surgery, but after surgery, to reduce the reoccurrence of cancer, or just to improve the general answer of the organism of the animal to the cancer treatment and its development, if after surgery unfortunately there is still cancer. So after surgery, early stage inhibition of cancer, we can back to those stages. So if you see this figure, when we make a surgery, we are somewhere here, and after surgery, we on the initiation stage or even here, normal stage, there is no cancer at all. So this is an ideal situation here. So given the resveratrol quercetin, it might stop the development of the cancer here. So it's of course it's a theoretical scenario, but it might work like this. And also the resveratrol and quercetin as well. It's a very good immunomodulator. Actually, the product is 8 years in the market, and we've never heard that there were some side effects in the context of immune overstimulation of immune system. So it's modulating positively the immune system, and you know that immune system is the first fighter in a cancer, in the dealing the organism with cancer. During chemotherapy is the third, let's say, possibility of usage the neoplasmoxan. And as Eva mentioned, it's always worth to check out the drug.com database to check out if there are any side effects or some negative influences of some substances. So we all should always encourage you to do it. Also for our substances, our products in general. But in the scientific literature, you will find a lot of data that resveratrol and quercetin, it improve the action of the chemotherapy. And this phenomenon is called chemosensitization. Here, right side of the slide is a figure that we use in our promotional material, where the quercetin together with tamoxifen had a much better effect in the context of the proliferation and the tumor volume than tamoxifen alone. And during palliative care, if we cannot do anything more, if we cannot find any other treatment, we can use our products, and we also have positive signals from the field, from the veterinarians, that products will support improve the comfort of life, reduce the symptoms or side effects, improve welfare, improve a lifespan even. So sometimes veterinarians were surprised how long the actual animal lived, because the prognosis were much worse. And also it can be used for a prophylaxis, but this kind of usage is in the veterinary medicine is at the beginning, because many breeds or certain situations are connected with the higher likelihood of the cancer development. So then this type of products can be used in a prophylactical way. So at the beginning, we mentioned that there is a research directly on the neoplasmoxan. So we had a lot of research, you've seen the examples about the ingredients, and often we had the questions, why you do not have a research directly on the product? So we made the research. We collaborate with the Research Institute of Oncology in Gliwice. It's very good Polish institute. It's concentrated on the human medicine. There is a hospital, but additionally to that, there are some scientific departments like a Central for Translational Researches and Molecular Biology Center. So we had fantastic occasion to collaborate with them, and it's ended up with this publication. When we came to them and asked them about the collaboration, you know, we have such a supplement with this, and this, and they were really interested because they know the substances alone and their actions, and they wanted to check out them in a combination. So the research lasts 25 days. In general, the administration time was 21 days, and we used the xenotransplant model of mice with CT26 colorectal cancer applied to them. I will tell you about the model in a couple of minutes. On the next slide, we have in total 18 mice biopsy, and they were specially prepared to this kind of the experiment. So they were immunosuppressed because this is the type of the model that they have to be like this. So the researchers gave them subcutaneously the cancer cells, and this type of cancer is developing pretty fast. So only few weeks were enough to to see the progress of the cancer very fast, and also to check out does neoplasmoxan works or not. And we have two control groups and neoplasmoxan group. Just 1 word, 2 words about the model. We use the xenograft model of the mice. So the principle here is that we use well-known cell cultures from humans and inject it to mice, and it's developed cancer very fast because it's immunocompromised. There are also different models of the cancer research, not such a popular because of they are more complicated in the technical way or in the ethical way, like companion animals. But the best model for the cancer research for humans is actually the dog. But it's not very handy and ethical, as I mentioned. So just to give you a basic results from the research, the scientists found that the neoplasmoxan inhibits the tumor growth by 30%, so pretty nice. Also, the tumor wave was much smaller, if you see here on the figure, and even by naked eye you can find out that the size of the tumor dissected was smaller. So this row here. And also what is very important, we mentioned you about angiogenesis, me and Eva here a few times. So also the angiogenesis was significantly smaller in a neoplasmoxan group, and the number of cancer blood vessels was 20% smaller than in a control group. So in conclusion, in the present study, neoplasmoxan showed the inhibition of the CT26 colorectal cancer cell growth. Okay, so thank you for your attention.
Thank you, Krzystof. Some are still coming in. Someone have any question about this? Maybe someone have already comments because tried this neoplasmoxan and could share some reviews to colleagues. Don't be shy. But if we haven't got any questions, then I think we will finish this evening. thanks to everyone who could manage this evening for studying and hear new information. And we will send record later to you all would participate here. We will say big thank to Eva and Krzystof for your time, for your presentations and information. And I hope we will manage something more as well in future, because I think it was really interesting. And thank you for sharing your,
Thank you for the organization, and thank you for your time as well.
Yeah, I think no questions. Then have a nice evening, everyone, and bye.
Bye-bye.